The hip and knee are the most stressed joints in the body. Their bony structure, surrounding muscles and ligaments restrict excess movement at the joint and provide stability. At the points where bone meets bone, layers of cartilage reduce friction and act as shock absorbers. Any reduction in the normal function of the joint can have adverse effects on the activities of daily living, such as getting dressed, walking, and bending. The most common reason for someone requiring a knee or hip replacement is osteoarthritis. This condition affects the structure of the cartilage and typically presents with painful, possibly inflamed joints and a reduced range of motion.
Recovery and rehabilitation begin a couple of hours after you return to the ward, once the effects of anaesthetic have worn off. Therapy staff will instruct you in safely standing and walking with a walking aid such as Zimmer frame, crutches or walking sticks, and also how to perform specific exercises. You can expect to be on the ward from 0 to 2 days.
In a total hip replacement, both the pelvis and thigh bone are prepared so that the correct sized prosthesis can be inserted and secured to create your new hip joint. The implanted hip joint is made up of 3 secure parts. The stem secures the implant to the thigh bone, the femoral head is the new ball of the joint, and the acetabular component is the new socket. There may be restrictions on how much and in which directions you're allowed to move your new hip joint, and if so, you'll be informed of these during your recovery.
Like the hip, both the thigh and shin bone are prepared for their halves of the new joint. The patella is sometimes also fitted with a new smooth surface to give the smoothest movement possible in your new knee. This prosthesis, like the hip, is made of a hard-wearing, long-lasting alloy to ensure your new joint continues to function for many years. The new joint is tested through its full range in the operating theatre. A follow-up X-ray is used to confirm integrity and position of the new joint prior to your discharge.
Early and regular mobilisation is essential for optimal recovery following joint replacement. Therapy staff will aim for a consistent progression in mobilising in terms of distance and walking aid required. Exercises and mobilising need to be continued and progressed once at home for best results.
Joint replacements are particularly traumatic surgeries for the muscle and tissue surrounding the joint. Pain is unavoidable, but with clear communication between you and your nurse, it can be controlled. As advised by the nursing team, taking breakthrough pain relief before your therapy sessions will help control the pain, but you must ask when you need it and as often as you need it. The pain will only go once you get moving, and we are here to help you with that.
If you are able to begin your exercises before your surgery, you can speed up your recovery. The exercises focus on the fundamental movements of the joint, and the strength of the muscles they target will ultimately determine your ability to walk, sit, stand, and perform all the movements necessary to move about your house and out in the street.
We are aiming to strengthen all your thigh and hip muscles. These together will support your new joint in achieving its full range and moving as comfortably as possible. Following surgery, your muscles will feel heavy and will take time and practice to fully reawaken and function as normal.
For the knee, there are specific targets set for strength and range of movement, namely, being able to fully straighten the leg and lift it in that straight position, and bending the knee to 90 degrees.
Activation or waking up of the thigh muscles will be needed before straightening and lifting the leg is possible. While bending the knee will be initially painful, consistent effort will help you achieve the 90-degree bend.
There are no set targets for the hip exercises. Rather, you should progress towards equal strength and range of movement on both operated and non-operated sides. The operated hip should ultimately feel equally secure whether it is the working or supporting leg.
Home is where most of your recovery will take place. We can have you home as soon as you are safely mobile and are able to complete your exercises and stairs if required.
At home, you need to continue and progress your exercises as advised by the therapy team. Ultimately, the outcome of your surgery is dependent on you. We are here to help, and there will be either a telephone or face-to-face follow-up scheduled to see how you are getting on. You can contact us at any point by telephone or email if you have any questions or need any advice.